Sam is a late effects lead radiographer. In this video, she answers some of your questions about radiotherapy and late effects. What is a late effect?
Okay, so radiotherapy late effects are symptoms that could happen anytime from maybe 3 to 6 months after your radiotherapy is finished, or even up to many years later. Or you might actually find that the side effects you had during your treatment and in those few weeks afterwards never actually went away. But having said that, many people do go on to recover and return to their roles or responsibilities and hobbies after their cancer treatment. But there will be some people who have ongoing issues or concerns. So if you had your pelvis treated, you might have concerns about how your bowel or bladder are functioning. You might have some gynecological symptoms or erectile function concerns. But if you had your head and neck treated with radiotherapy, you might find that your symptoms are more about swallowing, dry mouth, or altered saliva. And whichever part of your body you had radiotherapy to, you might have concerns about intimacy, sexual well-being, and relationships. And this isn't a complete list of late effects that you might have from radiotherapy, it's just some examples.
What causes late effects?
Radiotherapy treatments are very precise and very targeted. Having said that, in order to give the best dose and the best treatment that we can to fully ensure that the cancer is treated, there is some dose that does treat surrounding tissues, and that's why you can get radiotherapy late effects after you've completed your treatment. So, and it's also important to understand it's not that your treatment was wrong, and we will, when we're looking to support people with late effects, go back and have a look at their treatment planning, any images that were taken during the radiotherapy, so that we can compare what we did during radiotherapy treatment to what you're experiencing currently, and ensure that that is potentially what we would expect.
What do I need to know about late effects and how can I handle them?
When you go through radiotherapy, you will go through a consent process, and you may or may not at that time have been given some information about radiotherapy late effects. But you may find as time goes on that you don't recall that information, because at the time when you're going through treatment, there's so much to take on board. So it's important to understand that not everyone experiences late effects from their radiotherapy, but a few people do. And sometimes these are not particularly significant and don't have much of an impact on your daily life, but in other instances, they can cause problems which affect your functioning and your quality of life. So we're not sure about timescales, they're very variable, and how severe you may experience your late effects. But what we do know is that they can start anytime from 6 months to many years after your radiotherapy. So late effects can affect all of you in terms of feeling tired and fatigued. They can affect how you carry out your daily activities, and they can also impact on intimacy and relationships and your well-being. So the role that you may carry out, how well you're able to work or care for others. But also late effects can be very specific to the area of the body that we treated. So if we were treating your pelvis, then the physical symptoms will affect your pelvis, or if we were treating another part of your body, they would be specific to that. It's very important that we consider what's important to you at the time that we're talking with you about your radiotherapy late effects, and what matters most to you and what your concerns are. So we want to make sure that when we see you to discuss any concerns you have around radiotherapy late effects, that you feel heard and listened to, and that we are working together to form an action plan to reduce the impact that your late effects may be having on you.
How can I tell the difference between a late effect and the symptoms of a new or returning cancer?
It's really important, if you've developed new symptoms, that they are checked out and that you see your GP or speak to your cancer specialist about the symptoms that you're having, so that we can rule out any cancer possibility and also get you the help that you need as quickly as possible. to help if they are due to radiotherapy late effects. And it's a big fear that a lot of people have, that we see within a late effects service. Quite often when you've gone through cancer treatment, that fear of cancer returning or having a new cancer is really, really common and can often be at the forefront of your mind. So the answer is really that initially, when we're not sure whether these symptoms are due to the cancer or whether they're due to late effects, and it's really important that that is ruled out. But once we know that the symptoms are not due to a cancer, then we can work together to try and improve how you're feeling.
Did I do something wrong during treatment? Or did my treatment go wrong? And this has caused my late effects?
That's a really, really understandable worry. And lots of people that I see within my late effects service often ask the same question. So it's really important that people understand they're not to blame, that it isn't that they've done something wrong. It's not because they didn't follow the advice or do any preparation properly. It really isn't due to that.
Will my late effects ever stop?
I think it's really important that we do manage expectations appropriately. And sometimes by the time I see somebody who's experiencing late effects, they may have been struggling for just a few months or maybe for many, many years, and finding it difficult to get appropriate help and support. So sometimes late effects don't go away, and it's important to be honest about that. And also sometimes they may be progressive and they may get worse. In other instances, late effects do improve and do settle. But what's important is that we are trying to work together to reduce the impact that the late effects have on somebody's ability to do the things that they enjoy and improve quality of life. So although we can't make late effects go away, we can improve things and reduce the impact that they have on people. Things may never go back to how they were prior to radiotherapy, and that's really important. And also, depending on the timescale between radiotherapy and late effects, it's important to realise there's also a natural ageing process that goes on alongside that, and general health and well-being also can deteriorate during that time too. But you know, that's not to sound too sort of downhearted about what we're doing to work with people with late effects. There is a lot that we can do to help support people.
Is it just me? Can I get any help with late effects?
No, it's absolutely not just you. And actually going through the experience of having radiotherapy late effects can be very, very lonely, because people do feel like they're struggling on their own, and people don't really talk about it very much. There's an expectation, generally, I think, that once you've gone through your cancer treatment and everything's finished, that you'll be back to normal. Friends and family expect you to be back to normal and don't really understand why people aren't feeling very well or not able to do things that they used to be able to do. So that's really important to realise that you're not on your own, and it takes time. So we do a lot of work on trying to sort of educate not just people who've had radiotherapy, but their family and friends and loved ones and other healthcare professionals as well, to realise that this isn't unusual necessarily, but that there is support around and help for that. So it's really important, if you think you're experiencing late effects, that you do tell your healthcare professional. And that can be quite difficult if you're not under follow-up anymore from oncology or from your treatment. But going to your GP or calling your GP, letting them know what you're experiencing so that it can be investigated, and then you can be signposted to more specific support. There is help available. Radiotherapy late effects services are starting up all over the country, but it's important to realise as well that actually in some areas of the country it's not great, and there aren't services everywhere. Having said that, there is support and there are help from other specialist services, even if they're not specifically radiotherapy late effects. So I think what's important is that hopefully we can give people confidence to know that they can go and ask for help and they can shout about what they're experiencing, so that they do find someone who can help support them.
Can I get any support from patient groups?
There are lots of charities working nationally and locally who can help signpost towards support groups or help from other people who are experiencing different things. You sometimes find when people do see us in a late effects service that they've often come across healthcare professionals or people that they know who say, well, you know, you've had your cancer treatment, this is how it is, what do you expect? And actually that's really difficult because yes, people have had their cancer treatment and often feel very pleased and grateful that they've had that, but there is help and support out there. And I think if you're finding that you can't get anywhere via your healthcare professional, then have a look online. You can search for support groups or search radiotherapy late effects, and then information will come up. There are a lot of local services, local charities and peer support groups, and also on social media as well. Obviously we always recommend that you're looking at reputable sites, but there is a lot of support out there, and there are national charities and support groups that can be really helpful.
Am I ever going to feel normal again after cancer and cancer treatment?
That's really, really, really good point. And the word normal is really interesting, isn't it? Because I think when you've had a cancer diagnosis and cancer treatment, normal isn't something that exists afterwards, and it's trying to adjust to how life is, the fact that you've been through such a huge experience, and there's an expectation from friends and family and sometimes other healthcare professionals that you will just return to normal and carry on as you were before. But it's really difficult, and it's about being honest with people, I think, and telling your friends and family how you feel and what you're experiencing. And for us as healthcare professionals to make sure that we're educating people on what life can be like after you've had cancer treatment. People who come and talk to me often say that they feel guilty, guilty to be, you know, being seen to complain, maybe that they're not finding life really easy and things are really difficult, which makes it harder for people to come forward and say that they are struggling. And I think that's why it's really important to know that you're not alone, and that late effects can be really significant and can have an impact on your life, and it isn't your fault, and you don't need to feel guilty, and that actually, you know, we are here to try and help support you in moving forward and improving quality of life.
Can I ask for help with late effects in my treatment follow-up appointments?
It's important to remember that when you're going through a cancer follow-up process, that actually the main aim of that is to make sure that your cancer's gone and that you're cancer free, or that everything is staying the same. So actually within that oncology setting, our main aim isn't looking at radiotherapy late effects, it's looking at the cancer and the disease and how you are in terms of that. So I mean, I would say it's absolutely important that you go with your list of questions and you write them down and you take with you what you want to talk about. And actually, if you're struggling with what you think are radiotherapy late effects, it's entirely appropriate that you mention it at that appointment, but that also that might not be the place where you do receive the support and advice that you need in order to help manage and live with late effects. And it may be that you're referred out of that service to other specialties, hopefully to a late effects service if there is one within your area. But absolutely, it's important to raise your concerns.
Cancer treatment has changed my intimate relationships. What can I do?
I think, again, as we've said earlier on, it's really important to know that you're not alone, and that cancer treatment can impact everybody's intimacy and well-being and sexual life, absolutely, regardless of where you've received your radiotherapy treatment on your body. Our intimate relationships are really tied up with our emotional well-being. And if you're finding that you're worried and anxious about symptoms that you're having, or you're having physical symptoms on any part of your body, actually that really impacts on how intimate you want to be in your relationship. So absolutely, you're not alone. And as I said before, please talk to your healthcare professional about it. There are lots and lots of support and help and information out there on living with the effect of cancer treatments and the impact that has on you and your sex life and intimacy, and it's not all about having sex. It's about, being close to somebody and holding hands and kissing and just feeling close and loved. And we know very, very much that cancer treatments, radiotherapy late effects can really, really impact on that.
Thank you for watching. Please share this video if you know anyone who would benefit from this information.